Hi guys, so today I'm going to be summarizing the topic of pneumonia and I'll be jumping right into it. So first of all, with the definition, what is pneumonia? It's basically the infection involving the alveoli or basically the parenchyma of the lungs. So who are at risk of developing pneumonia? These people are people that are at risk are young children and elderly, also immunocompromised and immunodeficient patients. And now we have the different way of classifying this pneumonia, and we classify on the basis of etiology, basically the organism that causes them or how we acquire them. So basically in the etiology we can have viral, respiratory syncytial from respiratory syncytial volume most commonly, bacterial strep pneumonia most commonly. I have listed only most commonly causing organism from each group. Fungal is Cryptococcus, mycoplasma pneumonia, protozoal pneumocystis carini, and non-infectious inhalation or eosinophilic. Now the other way of classifying is it's whether it's community acquired or acquired from the hospital. So basically the most important community acquired infections are Streptococcus pneumonia, Haemophilus influenza, Chlamydia pneumonia, Mycoplasma pneumonia, and hospital acquired is most important Strep aureus and Pseudomonas aeruginosa. Now, what are the predisposing factors that make you at risk of your getting pneumonia? This is age that I discussed before, COPD, or diabetes, heart failure, immunocompromised states, alcoholism, smoking, travel, occupation, and recreational exposure. These are the your predisposing factors that are involved in pneumonia. Now, what is morphological types? There are two morphological types. There is broncho and lobar pneumonia. And in bronchopneumonia, there is patchy consolidations, and this is caused by Staph aureus, H. influenza, Klebsiella pneumoniae, and Streptococcus pyogenes. In lobar, there is a fibrosuppurative consolidation in entire lobe. The entire lobe is involved, unlike patchy consolidation that are seen in broncho. So, most commonly involved bacteria in lobar pneumonia is Strep pneumonia. Now, what is the clinical picture of this pneumonia? So the clinical picture is your coughing. These are typical symptoms. There are atypical symptoms as well, and they are based on different organisms. So typical organism that causes are streptopneumonia, Haemophilus influenza, and very others. These are the most common that cause the common clinical picture, that is cough, sudden onset of fever, sputum production, pleuritic pain, signs of pulmonary consolidation, dullness, egophony is like E to A, changing of sound, bronchial breathing sound, rales, and increased firmitus. Now, the atypical organism, most commonly Mycoplasma pneumonia, Chlamydia pneumonia, but now, right now, we are seeing COVID-19 as a major cause of atypical pneumonia. We have all know that. Now, the main atypical symptoms are dry cough, chest pain, extrapulmonary symptoms, headache, myalgia, fatigue. You can see the similar symptoms with your COVID-19 as well. Now, how to diagnose this? You can diagnose it by chest XR, Grimes chain culture of sputum, and biomarkers such as CRP, PCT, and blood culture. For what? Hospital acquired pneumonia, because you can observe these organisms such as Staphylococcus aureus and Pseudomonas aeruginosa are gram-negative bacilli on that. Now, there are 4 stages of lobar pneumonia that are important. There is first is congestion, radicalization, rehabilitation, and resolution. I will discuss about it later, but this is the short summary of the pneumonia.